I realized I wanted to be a physician in my early 20s. And that was after I did some soul searching and tried other careers on for size by doing internships or working in a lab. And I realized at some point that I was really driven by interpersonal relationships, and that the analytical part of me really appreciated understanding how things work, and the personality part of me really appreciated how to connect with people. And I had realized how strong my drive was for social justice, and that putting those things together, in addition to wanting to really educate parents about kids and realizing that's what you do as a pediatrician. And so when I put all those things together, I realized that being a pediatrician was probably the best choice for me. My whole career has really been focused on serving children in foster care and kinship care and those who've been adopted. And early on in my career, I realized that they needed advocates, that there were many experiences that they had related to moving from home to home or having short child welfare case managers who might change. And that sometimes as a pediatrician, you were the person who was involved in their life longer than anyone, but perhaps their birth parent, and they didn't live with their birth parent. So sometimes I had history about children that other people didn't have. And it's really important to us to be able to really advocate on their behalf, and also to help others understand the complexity of their experience, that they've experienced quite a bit of toxic stress, and that those experiences really impact their behavior, it impacts their development, it could impact their brain growth. And so when children act in a way that may appear atypical or maybe disruptive, or they may have disproportionate emotional responses, to really understand that it's the child's appropriate response to an inappropriate situation. And so looking at the child from a trauma-informed lens is very important, and our council has been really on the forefront of doing that work in trauma-informed care, just in terms of trying to help families understand that. We have a strong advocacy team at the national level and at each state level. And we have been able to accomplish great things through the American Academy of Pediatrics to help improve the lives of children and families who are impacted by foster care, adoption, and kinship care.